muscle spasm. And it is caused by Clostridium tetani, which is a gram-positive. It's tetanus. It is a neurological disorder that is characterized by the spasm of the muscles. Therefore, the patient will have spastic paralysis of the muscles. And the disease is present since the early days. It has been described by Hippocrates since the 400 BC, and detected the bacteria was detected by Rosenbach around 1886. It was seen as a bacillus with a terminal spore in patient having the symptom of tetanus, and later it was isolated by Kitasatu in around 1889. That is a short history. The tetanus, it is a disease of spastic paralysis, and it is caused by the bacteria Clostridium tetani. I'll come to the bacteria later. And there's the spasm of the muscles, and according to the involvement of the muscles or the part of the body, it can be divided as generalized, cephalic types, localized types, and neonatal types. Mainly it is generalized and localized. So generalized means in any part of the muscles of the body is involved. So there is an injury, the bacteria enters into the body, and because of the neurotoxin at the local site, which gets spread all over to the body, and because of its pathogenic feature, it produces the paralysis. And in generalized type, it will involve the muscles of all of the body parts, different parts of the body. Mainly, there are specific features. One is trismus, that is lockjaw. So it involves the masseter muscles. So it produces lockjaw. So one cannot properly open the mouth. And another is rhizus sardonicus. So you can say devil's smile, or there's a peculiar type of smile in the patient that is because of the paralysis of the facial muscles. And another is opisthotones. That means dhamashtanka, because in Nepali we call tetanus as dhamashtanka, because there is going of the back because of the spasm of the muscles of the back. The body is arched backwards. That is opisthotones, and because of this feature, disease tetanus in Nepal is called dhamashtanka. And there can be involvement of other muscles as well. So patient may have difficulty in swallowing, and sometimes there can be involvement of the chest muscles, therefore producing difficulty in respiration, and the patient may even collapse. So this because of this muscles and different muscle involvement. So the peculiar feature commonly are in the generalized type of tetanus. Those are trismus, that is lockjaw. Another is rhizus sardonicus, where there is a peculiar type of smile, and opisthotones, that is bowing of the back. And if there is severe involvement, it can be involvement of the chest muscles or the respiratory muscles, therefore producing difficulty in respiration, and patient may collapse. Or autonomic nervous system may also be involved, and in that case, patient will have sweating, hyperthermia, arrhythmia, or fluctuation in the blood pressure. So one common type is the generalized type. Another is the localized type. So sometimes the disease may just be localized at the site of the entry of the bacteria. It produces the toxin, and the toxin may be localized at that area of the injury, so involving muscles of that particular area, that is the muscles at the site of the injury. So there will be spasm of the muscles around the site of the injury or the wound area. So that is the type of localized tetanus. And cephalic type, it is a more severe form. We can consider it as a localized type of tetanus, but there is involvement of the head area. So when the injury is at the head area or nearby the head area, then it involves the muscles of that side, and there is involvement of the cranial nerves. So since there is the involvement of the cranial nerves, particularly the seventh cranial nerve is most commonly to be involved, and there will be severe prognosis in cephalic type of tetanus. It can also be considered as a localized type of tetanus. And in neonatal type, it is again a localized type which can progress to the generalized type of tetanus. So neonatal tetanus is common due to the contamination of the umbilical stump. So during birth, because the umbilical cord, and during that time, if the instrument that is used to cut the umbilicus is contaminated with the organism, then the neonate may develop tetanus. So from that side, it may progress and develop generalized disease as similar to that in case of the adult ones. Okay, and prognosis is poor if if the baby is born from non-immune mother. So these are the types of tetanus. So this is the stiffness of the muscles showing bowing of the back. In the picture, another picture of lysis sabronicus. So there is paralysis of the facial muscles. Now the pathogenesis of this disease. The positive percent of tetanus is um, Clostridium tetani. So this Clostridium are a group of gram-positive bacilli which are anaerobic. So these are anaerobic organisms, gram-positive bacilli, and they produce spores. And among the Clostridium tetani is the positive percent of tetanus. And the pathogenesis of this disease is because of the contamination of wound by the bacteria. When the wound is contaminated, especially deeper wounds having necrotic tissue, suppose there's an open fracture or an open wound and that is contaminated by the soil, bacteria gets lodged in the wound, and if the wound is deeper and there's presence of devitalized tissue, necrotic tissue, it produces an anaerobic environment. And as Clostridium tetani, it is Clostridium are anaerobic bacteria. So if the devitalized tissue, that will produce the anaerobic environment, so that will provide a favorable condition for the growth of the bacteria. And if the spores are lost in the wound, then the spores germinate to form the vegetative form, and as the bacteria are lysed, they produce toxins. And the toxins are mainly of two types, titanospasmin and titanolysin, but the main pathogenic one that is the role in the infection is the titanospasmin. And this titanospasmin then at the site of infection, they are produced and they enter through the motor neurons, and they travel through the axons in a retrograde manner. And this toxins, because of these toxins, at the synaptic junction of the motor neurons, there is inhibition of the inhibitory neurotransmitter. So there's excess accumulation of excitatory neurotransmitters. So the main role of the main pathogenesis of this toxin is they inhibit the inhibitory neurotransmitter like GABA and glycine, because as the GABA and glycine, which are the inhibitory neurotransmitters, are inhibited at the synaptic junction of the motor neurons, there is excess accumulation of acetylcholine, and there is excess acetylcholine, it will cause contraction of the muscles. And there are no, since there are no inhibitory neurotransmitters, the action of acetylcholine is not controlled. Therefore, there is continuous contraction, therefore producing spasm of the muscles. That is the pathogenesis of the disease. So this titanospasmin, which has the main role in the pathogenesis, is the neurotoxin. And another is the titanolysin. Its role is exactly not known. It is considered to be a leukocidin, so it can destroy the leukocytes, and it is a hemolysin. So in culture, the organism that is the Clostridium tetani it shows hemolysis, and the hemolysis is because of this toxin tetanomycin. Now Clostridium tetani. So the organism causing tetanus is the Clostridium tetani. Belongs to the class Clostridia, family Clostridiaceae, genus Clostridium, and species tetani. Now the Clostridium, the diagram I have already mentioned, the diagram positive bacilli, they are obligate anaerobe, so they require anaerobic environment for growth, and they produce spores. And depending upon the type of the species, the location and the shape of the spores may vary. And for Clostridium tetani, it has a terminal spherical spore, so it produces a drumstick appearance. And because of the location of the spore and the shape of the spore, when we examine the bacteria under the microscope, it appears as drumstick. So gram-positive bacilli measuring about 4 to 8 micrometer by 0.5 micrometer, they can occur in chains, or they can be single, and they produce spores. So spores are terminal spherical spores producing drumstick appearance of the bacilli, and these are motile bacilli. Clostridium are motile bacilli, and among the Clostridium tetani, there are about 10 strains based on the flagellar antigen, that is the H antigen. So they are typed as 1 to 10, and all of them are motile except type 7. So Clostridium tetani is motile except for type 6. Okay. And it is a spore producing bacteria, and the spores of this bacteria are commonly found in the commonly manure soil, because this organism is found in the feces of the animals and also of humans. So they can be found in the intestinal tract of the man and the animals. Therefore, the soil contaminated with the human stool, or which has been manured with the animal excreta, can contain the spores or contain the bacteria. In cultural characteristics of this organism, it is anaerobic. So this is an obligate anaerobic organism. Temperature as other bacteria, that is 37 degrees Celsius, and it can grow in ordinary media, but we have to provide as the anaerobic condition. And this produces a swarming growth. So when you culture the sample or culture the organism in the plate providing an anaerobic condition, it produces a swarming growth because of its motility. So rather than a discrete colony, it produces a thin film, because the bacteria spreads over the culture plate and produces a thin film. So that is the swarming growth. And so we can use culture media like blood agar, which is a solid media, or we can use anaerobic culture media like the so low percent cooked meat media, and in low percent cooked meat media, it produces turbidity with gas formation, and this is a proteolytic type of organism. So it turns the meat black. So organisms, the RCM contains meat particles, and if the organism is saccharolytic, then it becomes the meat becomes reddish, and if it is proteolytic, it becomes black. So in RCM, Clostridium tetani turns the milk black because it is of proteolytic type. And we can again culture it in blood agar, and again directly culture it in blood agar or subculture from the RCM to the blood agar, and incubate anaerobically. And in blood agar, the organism produces alpha-hemolysin, and if you further incubate, then it produces beta-hemolysis. And the hemolysis is because of the toxin, that is tetanomycin. So you can see the swarming growth of the bacteria. So there's a thin film of the bacteria. So the bacteria is spread over the plate when you have kept the sample at one point. Rather than a discrete colony, it has produced the film of the growth of the bacteria. So that is the swarming growth. And biochemical reaction, the organism is proteolytic. So in RCM we can see that because it has changed the mid black in color, and it is indole positive, hydrolyzes gelatin, MR MVP negative, and H2S negative. And when you culture in some media containing nutrient like the macan yogurt, it produces greenness, fluorescence or greenness pigmentation. Resistance, because of the spore production, this can be highly resistant. So resistant to 5% phenol, 0.1% mercury chloride, and however they can be killed by boiling. But some strains may even be resistant to boiling as well. Now for lab diagnosis. Now, tetanus, it is diagnosed mainly clinically, so based on the clinical feature and the isolation. Every time we may not be able to isolate the bacteria even if the patient is having infection. However, we can perform the laboratory diagnosis for the to support the clinical diagnosis. And the sample collected is first sample or even the tissue, so infected tissue. And when you prepare a smear and perform the gram stain, we can see gram positive spore forming bacilli. So gram positive bacilli with the drumstick appearance that may be suggestive of Clostridium tetanus. So patient is having clinical features of tetanus, and they are having deep wound necrotic tissue. Take the sample, and in the sample we can isolate gram positive bacteria with terminal spores having drumstick appearance that may be suggestive, and we can culture it in RCM or in blood agar and incubated anaerobic. And further again some culture from the RCM. And in RCM I have already mentioned it produces turbidity with gas and meat becomes blackish because of the proteolysis. And in blood agar it produces fat translucent colonies surrounded by a zone of vitaminolysis. Or it can, if generally this is in a hard agar, and if the agar content is normal, then it produces swarming type of colonies. Now the toxin testing. So toxin, it is basically tested by animal inoculation. So in that is for the detection of the tetanus spasms. So major toxin that has a role in the pathogenesis is the tetanus spasm. So you can detect the toxin production by this organism, and for that we prepare a growth of the organism and inoculate, we inject that growth, which is about 2 to 10 days old. We inject that growth of about 0.2 ml into the test into the animal, that is the mice. So we inject that into the base of the tail of the mice. That will be the test animal and test mice, let's say. And another we can take is control mice into which we have injected the antitoxins. So we take 2 mice, both of which we will inoculate the growth of the organism, growth culture of the organism, that is 0.2 ml of the broth into the tail of the mice, into 2 mice, and 1 will be the control. And in the control, we will have injected antitoxin 1 hour before we have injected the organism, the broth of the organism. And after some time, about 12 to 24 hours, then the test animal will produce the features of tetanus. That is, it will start producing spasm of the muscle. So the spasm will start from the side where we have injected, and progresses to the next limb and towards the trunk and whole of the body, whereas there is no change in the control mice into which we have injected the antitoxin. Another toxin, that is tetanulysin, can be detected by inoculation into a blood agar plate. But since this has not much role in the virulence, so that may not be of much significance. For detection of the tetanus, you can take a blood agar plate which is a hard agar, that is around 4% of the agar, and into half of the plate will inoculate, in half of the plate will have antitoxin, and in the other half will not have the antitoxin, and in both of the side will then inoculate the organism. And if there is hemolysis in one arm of the plate without the antitoxin, that it indicates there is production of the tetanomycin, and in the other, if there is no hemolysis, it indicates the antitoxin has inhibited the tetanus. So that is how we detect the tetanus. Now, treatment of the infection. Generally, tetanus, even it is common in deeper wounds with devitalized tissue or necrotic tissue, which favors an anaerobic environment. So we are suspecting a patient is having such type of infection and presence with incubation period generally around 4 to 6 days, or sometimes it can be weeks. And when the patient develops the symptoms, the symptom is present, we have to develop the necrotic tissue so as to reduce the growth of the organism. And we use antibiotics. Among the antibiotics, penicillin is the drug of choice. Another is erythromycin, metronidazole can be used. So as soon as the patient comes, one is surgical debridement of the wound and prophylactic antibiotics, and along with that, we give as immunoglobulin. So that is antitetanus immunoglobulin to neutralize the toxin. So if once the toxin is already bound to the neurons, then that cannot be neutralized, and we give immunoglobulin only to neutralize the unbound toxin. And we have to provide supportive management like the muscle relaxants, sedatives, and avoid the triggering factors like bright light, noise, etc. And for prevention, for prevention we have is the vaccines. One is the tetanus toxoid, which is the active method of active immunization. Tetanus toxoid, it is given during the childhood, so along with as DPT. So at 16, 14 weeks, DPT is given. So diphtheria, pertussis, and T for tetanus toxoid. And the booster dose can be given after 5 years and repeated every 7 to 10 years. And similarly, in adults, also we give as 3 doses first, that is first dose, and after 4 to 6 weeks, second dose, and then after 6 to 12 months, we give the third dose, and after 5 years, we repeat the booster dose and given after every 10 years, the booster dose is given. And passive immunization, that is at the time of the injury, that is the immunoglobulin is given. And another is we can give combined immunization. So whenever there is patient is having injury and we can suspect the patient may develop tetanus because the wound is deeper and it is contaminated with the soil, or the instrument that is cut is contaminated, then in that case we can also give as passive immunization, that is immunoglobulin, and along with that we can give the tetanus toxoid. For tetanus, it is a neurological disorder, but it is caused by the Clostridium tetani, which is mainly because of the tetanus spasmin. And since Clostridium tetani, it is an anaerobic bacteria, generally it favors the deeper tissues having necrotic tissues or foreign bodies. So such types of wound which have which can develop anaerobic environment and that is contaminated with the soil or any foreign particles that has the spores of Clostridium tetani, then the patient can develop tetanus. Or sometimes even surgical instrument during surgery, if the surgical instruments can sometimes be contaminated, that may be a condition that may lead to tetanus. And another condition which may develop tetanus is like in case of septic abortion, because the organism Clostridium tetani resides in the intestine, and sometimes septic abortion can result in tetanus that case. And sometimes minor wound also can develop tetanus. So we may think that small wounds may not develop tetanus, but sometimes even minor cuts, if the cutting object is contaminated or let's say rusted, because iron, that is the rust, it acts as reducing substance, so it may also provide an anaerobic condition. Therefore, the organisms can be present in such conditions. So, if that is why we say whenever there is puncture wound or wound with a rusted knife or a rusted nail, patient may develop tetanus. So that is why immediately after the cut, we give the tetanus immunoglobulin, tetanus vaccine. And so that is some of the common methods one can develop tetanus. And that's usually a malaria tetanus spasm. So when the bacteria enters into the wound, it is the bacterial spores is present in the wound, and if there's a favorable environment, that is the anaerobic environment, because of the foreign body, revitalized tissues, necrotic tissue, the spores will germinate, produce tetanus spasmin, and it enters through the neurons, and this tetanus spasmin then inhibits the GABA and glycine, which are the inhibitory neurotransmitters. And therefore, since the inhibitory neurotransmitters are inhibited, then there is uncontrolled action of the during the muscle contraction. So there is excess or continuous muscle contraction because of the excess of acetylcholine. The action of acetylcholine is the excitatory neurotransmitter that is not controlled because of the lack of inhibitory neurotransmitters. Therefore, there is spasm of the muscles, and spasm of the muscles, it can be at the site of the wound, that is at the site of the injury. So it will be of localized type, or it may progress to the whole of the body, producing generalized type of tetanus, mainly having features of opisthotonus, lysis cerebralicus, and lockjaw. And even the involvement of the respiratory muscle can result in the death of the patient. And among the localized type, another type can be cephalic, which is a more severe form, having a shorter incubation period and poorer prognosis. And neonatal tetanus, that can be considered as a generalized type, and the source of infection is mainly the infection of the umbilical stump. And after we have diagnosed it clinically, then we can isolate the organism, identify it by the crime scene, and if you want to perform the detection of the toxin, we can detect the toxin, and for treatment, provide the immunoglobulin. Immediately after we have suspected the infection, we can provide immunoglobulin if the wound is present. And with devitalized tissue, we have to remove the necrotic or the devitalized tissue, provide antibiotics like penicillin and supportive treatment, like the muscle relaxant because the spasm of the muscles, and sedatives. And we have to avoid triggering factors, especially noise and light, because those factors which are normal for other people will act as a stimulant um, for those patient with tetanus to produce the spasm of the muscles.